High blood pressure is one of the most common health issues in the modern world. Millions of people live with it every day, often without obvious or noticeable symptoms. Many people feel completely normal and do not realize that their blood pressure is elevated until a routine check or a doctor's visit. Over time, however, unmanaged high blood pressure can silently damage the heart, blood vessels, kidneys, and other vital organs. This is why doctors often call it a silent condition. The good news is that daily lifestyle choices can make a meaningful difference. What you eat, how active you are, how well you sleep, and how you manage stress all play an important role in supporting your overall well being. Among these factors, nutrition is one of the most powerful and accessible tools you can control every single day. Today, we are going to talk about 5 foods that doctors often recommend for people with high blood pressure. These foods are not exotic or hard to find. They are simple, affordable, and supported by nutritional science. This video is not about quick fixes, extreme diets, or miracle cures. Instead, it focuses on realistic, sustainable choices that can support your health over time and help your body function more efficiently. Let's begin with leafy green vegetables. Leafy greens such as spinach, kale, arugula, Swiss chard, and romaine lettuce are frequently recommended by healthcare professionals. One of the main reasons is that these vegetables are rich in potassium, a mineral that plays a key role in regulating blood pressure. Potassium helps the body balance sodium levels. When sodium levels become too high, blood pressure often rises. Potassium supports the kidneys in removing excess sodium from the body through urine, which helps reduce tension in blood vessel walls. In addition to potassium, leafy green vegetables contain natural nitrates. These compounds help blood vessels relax and widen, which can improve blood flow and reduce pressure inside the arteries. This process supports healthier circulation and can make it easier for the heart to pump blood throughout the body. Leafy greens are also low in calories and rich in vitamins, minerals, and antioxidants, making them a powerful addition to almost any diet. You do not need to eat large amounts of leafy greens to benefit from them. Even 1 or 2 servings per day can support cardiovascular health. Leafy greens can be enjoyed in many different ways. They can be added to salads, blended into smoothies, mixed into soups, or included in omelets and warm dishes. The most important factor is consistency. Eating small amounts regularly is more effective than eating large amounts occasionally. The second group of foods doctors often recommend is berries. This includes blueberries, strawberries, raspberries, blackberries, and similar fruits. Berries are well known for their high antioxidant content. In particular, they contain compounds called flavonoids. These flavonoids help reduce inflammation in the body and support healthy blood vessel function. Inflammation and stiffness in blood vessels are factors that can contribute to elevated blood pressure over time. Several studies suggest that people who regularly consume berries tend to have better blood pressure control and improved cardiovascular markers. Berries also support overall metabolic health and may help improve insulin sensitivity, which is another factor related to heart health. Compared to many sweet snacks and desserts, berries are relatively low in sugar and calories, making them a smart choice for daily consumption. Berries are easy to include in everyday meals. They can be eaten fresh on their own, added to oatmeal, yogurt, or cereal, or blended into smoothies. Frozen berries are just as nutritious as fresh berries and are often more affordable and convenient. Keeping berries available makes it easier to choose a heart-friendly option when cravings for something sweet arise. The third food group is fatty fish. Examples of fatty fish include salmon, sardines, mackerel, trout, and anchovies. Fatty fish are rich in omega-3 fatty acids, which are widely recognized for their heart protective benefits. Omega-3s help reduce inflammation throughout the body, improve the flexibility of blood vessels, and support healthier cholesterol levels. Over time, these effects can contribute to better blood pressure regulation. Doctors often recommend eating fatty fish about 2 times per week. This amount is generally enough to provide meaningful cardiovascular benefits without requiring drastic changes to eating habits. Omega-3 fatty acids may also help reduce triglyceride levels and support overall heart rhythm stability. For people who do not enjoy fish or cannot eat it regularly, omega-3s can also be found in plant-based sources such as flax seeds, chia seeds, and walnuts. However, fish remains one of the most efficient natural sources. When preparing fish, gentle cooking methods such as baking, grilling, steaming or poaching are usually preferred. Frying fish or pairing it with heavy sauces can reduce some of the health benefits. Keeping preparation simple helps preserve the nutritional value of the fish. Next, let's discuss whole grains. Whole grains include foods such as oats, brown rice, quinoa, barley, bulgur, and whole wheat bread or pasta. Unlike refined grains, whole grains retain all parts of the grain, including the bran and germ. This means they contain more fiber, vitamins, and minerals. Fiber plays an important role in heart health. It helps slow digestion, stabilize blood sugar levels, and reduce the absorption of cholesterol in the bloodstream. A diet higher in fiber is associated with lower risks of heart disease and high blood pressure. Fiber also supports gut health, which is increasingly recognized as an important factor in overall well-being. Many people consume refined grains without realizing it. White bread, white rice, and sugary cereals are common examples. Gradually replacing refined grains with whole grains can be an effective strategy. Choosing oatmeal instead of sugary breakfast cereals, brown rice instead of white rice, or whole grain bread instead of refined bread are simple changes that can add up over time. These small adjustments can support better blood pressure control and overall cardiovascular health. The fifth group of foods is potassium-rich foods, especially bananas. Bananas are one of the most well-known and accessible sources of potassium. Potassium helps counteract the effects of sodium and supports proper muscle and nerve function, including the muscles that control blood vessel movement. Regular potassium intake from whole foods can help maintain healthier blood pressure levels. In addition to bananas, many other foods are rich in potassium. These include sweet potatoes, avocados, beans, lentils, spinach, tomatoes, and oranges. Including a variety of potassium-rich foods helps ensure balanced nutrient intake. In most cases, potassium from whole foods is sufficient, and supplements are not necessary. However, individuals with kidney conditions or specific medical concerns should always consult a healthcare professional before significantly increasing potassium intake. It is important to remember that while food is powerful, it works best as part of a broader lifestyle approach. Doctors often emphasize that blood pressure is influenced by many interconnected factors. Physical activity supports stronger heart function and healthier blood vessels. Stress management helps reduce hormonal responses that can raise blood pressure. Quality sleep allows the body to repair and regulate itself more effectively. Staying hydrated also supports proper circulation. Even small lifestyle changes can have a meaningful impact over time. Walking more frequently, reducing highly processed foods, limiting excess salt, and creating simple routines for rest and relaxation can support better long-term outcomes. Nutrition should not feel restrictive or overwhelming. Instead, it should focus on nourishing the body and supporting its natural balance. Before we finish, it is important to clearly state that this video is for educational purposes only. It does not provide medical advice and does not replace professional medical care. Always consult your doctor or a qualified healthcare professional before making changes to your diet, lifestyle, or treatment plan, especially if you have high blood pressure or other medical conditions. Thank you for watching. Send this video to those who need to know this. Subscribe if the video was helpful, and don't forget to like the video.